First tonight, the Army is now at work supporting under-pressure health services in the Scottish Borders. 21 military personnel have been deployed to the Borders General Hospital near Melrose.
Nurses and other medical staff will be working with the area's health board until the 10th of November, although the Scottish Government says the mission will be kept under constant review. Iszatt reports.
In August, routine operations at Borders General Hospital were cancelled, with management saying that the rising COVID hospitalisations, general demand for inpatient beds and staff shortages were putting health services under unprecedented pressure. Those operations have yet to restart, putting even more pressure on the NHS here. Now, the Army have sent in 21 military personnel to help out.
They go through the Scottish Government and the Scottish Government then obviously come and request for military assistance, and that's the process. We are here to support our local communities, so we're always pleased, if we can, at times of need, to lean in and assist.
I think certainly having worked in the NHS myself, it's definitely more challenging when there's fewer people. And then people get stressed, and that's not conducive to a good working environment. So I just think having extra people with clinical experience should be really helpful.
Now, the Army presence will be seen around the wards as they're both registered nurses and medics, and it really hopes that they will be able to gradually reopen elective surgeries and help with the pressure on waiting times in the emergency department.
So we've got some registered nurses, so they'll be carrying out all the duties that registered nurses do. We've also got some Army medics, so they aren't doctors but they're trained in medicine, and they've also worked in intensive care units across the UK through the pandemic. So they're going to be supporting patient care in the clinical areas, in the wards, so across the wards in the BGH.
Now, it is certainly needed here because today NHS Borders warned people that there is a long waiting time still in the emergency department. They say that patients will be treated in order of clinical priority, and due to the limited capacity in the waiting room, if you are accompanying someone needing treatment, you may need to return to your car. Now, management here have said that the services have been under huge amounts of constraints.
I think everybody's aware the past 19 months have been an incredibly difficult and challenging time for us. So our staff have worked relentlessly and with real courage and compassion. Everyone's absolutely exhausted now. We have vacancies. We had them before the pandemic. We have more now. Staff have decided to retire after the experience because it's been so traumatic. So what we wanted to do was just to reach out and get all the help we can for our fantastic dedicated teams. The military have responded, and as you can see, they've deployed some soldiers to work with us and support us.
Considering we're in October, it seems that even with the Army here, there's still a huge pressure on the hospital with the winter season coming up. And the hospital have said that unless your situation is life-threatening, please call 111 and not come to the emergency department. Iszatt, ITV News, Melrose.